Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Grading of dyspnea, but this is according to Sherwood Jones classification. According to Sherwood Jones classification, the grades of the dyspnea are of four grades. Grade 1. In grade 1, the patient is able to do his household work. So the patient can do the work that he has to do. So he will do his work with moderate difficulty. If the patient does the household work with moderate difficulty, then it is grade 1. If the patient does his household work with greater difficulty, then it is grade 1B. Second, if the patient sits in a chair or if the patient sleeps in the bed, and if we ask the patient to get up, and if the patient who is confined to chair and bed, and if he gets up with moderate difficulty, then it is grade 2A. Grade 2B, if the patient is confined to chair and bed, and if he gets up with greater difficulty, then it is grade 2B. So grade 2A is seen when the patient is able to get up with moderate difficulty. Grade 2B is seen when the patient gets up with greater difficulty. Then we have grade 3. In grade 3, the patient is confined to chair and bed only. He is not able to get up at all. He will not be able to get up on his own. Then that is grade 3. Grade 4 is moribund patient or dead patient.
thank you and thank you for watching.